This book, containing 387 carefully worded pages, is a federal government report. Its title, Smoking and Health, a report of the Advisory Committee to the Surgeon General of the Public Health Service. It was released at noon today, and it says, in view of the continuing and mounting evidence from many sources, it is the judgment of the committee that cigarette smoking contributes substantially to mortality from certain specific diseases and to the overall death rate. That is the basic conclusion. The report says a great deal more, and it leaves a lot unsaid. But its key points are these. Item, cigarette smoking is causally related to lung cancer in men. In comparison to non-smokers, average male smokers of cigarettes have approximately a 9 to 10-fold risk of developing lung cancer, and heavy smokers at least a 20-fold risk. Item, cigarette smoking is the most important of the causes of bronchitis in the United States today and increases the risk of dying from chronic bronchitis and emphysema. Item, it is established that male cigarette smokers have a higher death rate from coronary artery diseases than non-smoking males. Item, high mortality of cigarette smokers is associated with many other cardiovascular diseases, including miscellaneous circulatory diseases, other heart diseases, hypertensive heart disease, and general arteriosclerosis. Item, pipe smoking appears to be causally related to lip cancer. Item, cigarette smoking is a significant factor in the causation of cancer of the larynx.
In view of the continuing and mounting evidence from many sources, it is the judgment of the committee that cigarette smoking contributes substantially to mortality from certain specific diseases and to the overall death rate.
The first crisis of confidence came more than 10 years ago. Dr. Ernest Winder of New York's Sloan Kettering Institute for Cancer Research lit a fuse in 1953. He announced that he had induced skin cancer in laboratory mice by painting them with cigarette tars. One of the first to point an accusing finger toward heavy cigarette smoking was a noted lung surgeon, Dr. Alton Oxner. And that was back in 1936, after discovering a dramatic increase in the number of lung cancer cases among patients.
We know that a man 50 years of age who has never smoked has 8.5 years longer life expectancy than a man the same age who has smoked a pack of cigarettes a day since he was 21.
Now let's suppose that at age 50, I, the smoker, decide to quit, and do quit. Are my prospects going to be better, or have I already condemned myself?
No, your prospects are going to be very much better. It is the one thing that will keep you from developing cancer of the lung.
Strong evidence incriminating smoking as a cause of disease has been in the public domain for nearly 15 years. The Public Health Service has officially acknowledged the hazards incident to smoking for nearly 5 years. The work of the Advisory Committee consumed 19 months. This nation can afford to wait no longer. The time for the federal government to act is now.